Hello everyone, welcome to the exercise and sports science, exercise physiology and physiotherapy presentation today. I'll just give everyone a couple of seconds to join as I can see our numbers going up. Thank you so much for joining us on this crazy open day online. We know it's a very difficult time, but we really appreciate you being very flexible and joining us. Before we begin today, I would just like to acknowledge the tradition of custodianship and the law of the country on which the University of Sydney campuses stand. We would like to pay our respects to those who have cared for and continue to care for country. I'm coming to you today from the Blue Mountains. So I'm on the land of the Gundungurra and Darug people, and I would like to pay my respects to elders past, present and emerging. So before we begin today, focusing on the different areas of specialty, I'm just going to go through a bit generally about studying at the University of Sydney and why studying medicine and health at the University of Sydney. I'm Grace, I'm a third year occupational therapy student. So I have a little bit of experience and I might talk a little bit about my journey in choosing medicine and health at the University of Sydney as well. So I think in year 12, there's a lot of options. You may be choosing between physio, occupational therapy, exercise and sports science, but they all have a lot of similarities in terms of wanting to care for people and making a difference, being in a team, which I think has been my favorite part of my degree, is working in the multidisciplinary areas. Especially with COVID and the new pandemic, it's a very large growing employment sector and there's increasing numbers of jobs in different areas that you can study. And it's variety and lifelong learning. There's no end to options that you have and what you can do as a health professional, which I think is one of the best things. Another great part of studying health is that it isn't limited just to New South Wales and it isn't just limited to Australia. So your options in studying overseas or practicing overseas are also really great, and also it's obviously well paid, trusted and valued in our society. So the Faculty of Medicine Health at the University of Sydney is one of the fastest growing employment sectors. You'll learn from a great range of experts and academics and practicing clinicians, so you get the best hands-on experience through your degree. So as you can see here, we have the broadest range of health degrees at any Australian university. We have a research intensive in solving problems in healthcare, so a very evidence-based practice in all of our degrees. We have the largest network of clinical schools and industry partners in Australia, and we're the top ranked in the world. So if we look down the bottom for anatomy and physiology and sports-related subjects, we're doing very well, especially for sports-related subjects, as we'll talk about today. We are number 3 in the world. So definitely one of the blessed places that you can study if you want to get into that area. So the University of Sydney, when we're looking at our medicine and health faculties, we have 7 different schools and 10 clinical schools that you can study across. We have amazing facilities. I'll go through a little bit more in detail on the next slide, I believe. But we have amazing simulations clinics for both the dental and nursing students, laboratories for speech science. We have rehab gyms for the physiotherapy students. There's a really great range of facilities that we have available all across the board. We also have a really great range of industry partners, which part of the best part of the medicine and health degrees is the practical experience you get. Personally, in my degree, we have 1,000 hours of placement and I have just completed 600 of these hours this year. So I got to complete a placement in the far north coast of New South Wales up near Lismore, and then I completed another placement at Nepean Hospital. So there's a great range of options that you can work under, and as you can see here, 28 teaching hospitals, 16 research institutes, 7 local health districts, and there's amazing examples down the bottom of the places that we also teach. It's not just limited to New South Wales and it's not just limited to Australia. So in my opinion, that is the best part of the medicine and health degrees at University of Sydney. But we do also have an amazing new building on campus, which only opened at the beginning of this year, the Susan Wakehill Health Building. For any student studying next year, this building has hardly been used, as we're obviously all online at the moment. But there's amazing facilities, clinical studios, research gyms, rehab gyms, a 24-hour library if you'd like to study. So there's some really great options for all of our students in the new building. And it's a great place for all health students and nursing students to come together and study collaboratively. And if we look at what is changing in health and the different areas that are emerging, I won't go through all of them, but a big part of that we're trying to incorporate into our degrees is the digital health and the technological advances. And USyd does really well to stay on top of that kind of technology upgrades and the research, which I think is really important for health professionals to be up to date on that kind of information. So this is what you're here for. So we have 3 different programs that we will be talking about today: physiotherapy, exercise physiology, and exercise and sports science. We will be kicking off with physiotherapy today. So I will hand over to Associate Professor Deborah Shirley, the Program Director of the Bachelor of Applied Science in Physiotherapy, to take from here.
Thanks, Grace, and welcome to everybody listening to this webinar today. So I thought I'd start off with maybe telling you a bit about the type of person that would be really good to have a career in physiotherapy. So I think the very fundamental thing is somebody who really just loves working with people, or you hear people describe themselves as a people person. So you just have to really like being around people, interacting with people. But other things that would also make you a good physio is if you like science, you like to understand how the body works. You're very comfortable around all ages of people. So in physiotherapy, we can treat anyone from tiny babies right through to the elderly. You have to also be comfortable doing things where you're in close proximity to people. So often the things the physio does, we have to touch people, touch their limbs, touch their back, etc., to treat them. So we're a very hands-on profession, and we also have to be very empathic. You're seeing people often in some of the worst times of their life when they're ill or when they've had an accident or injury. And so we have to be able to be very empathic to their situation. Another thing that would make you a good physiotherapist is if you're a critical thinker and you like to analyse and solve problems. So physios assess, diagnose and treat people, like I said, of all different ages. And what our aim is to maintain and restore maximum movement and functional ability. And some of the things we do that because they're affected by age, injury, disease, sometimes just developmental disabilities or neurological disorders. And maybe people are recovering from surgery or other things like childbirth, but as well as treating people that might have had surgery or an injury or whatever. We're also very much involved in health promotion and trying to promote people's health, improve people's risk factors, so less risk of developing chronic disease, so that they can be the fittest and healthiest they can be for life. Okay, so why would you choose Sydney to do physiotherapy? Well, like all physio degrees, we're accredited by the Australian Physiotherapy Council, which means that on graduation, you're eligible to apply for registration through the Physiotherapy Board of Australia, which comes under APRA. So that's essential to be able to practice physiotherapy. In our discipline, we have some of the world leaders in their areas of research. So we have one of the top whiplash researchers in the world. We have people who lead research in neck pain, back pain, other disorders like Parkinson's disease, concussion. These are to name a few, and it goes much more broadly than that. We also have a very big cardiorespiratory team who are doing some groundbreaking research there as well. We also, as part of your candidacy, give you opportunities for mentorship, both being a mentor and being mentored in the very early parts of your degree. And there are also programs to help develop leadership skills, and also opportunities for international involvement. Now, these were much better pre-COVID, and hopefully once we get settled into whatever the new normal is with COVID, some of the international opportunities will come ahead. At the moment, they've been translated into a more virtual platform, but the aim would be obviously to be able to have those as proper international opportunities eventually. And of course, during the degree, you do some clinical practice, similar to what Grace said for OT. We have 5 clinical placements of 5 weeks each, where you go to a health facility. It may be a public hospital, a private hospital, community, private practice, all sorts of different settings there. Cool. So in order to get into physio, you have to apply through UAC. The indicative ATAR for next year is 99.5. The physiotherapy degree itself has no prerequisites, but it would be advantageous to you if you have studied maths and maybe some of the other sciences, particularly physics, biology or chemistry. These are not essential, and it is possible to do a bridging course if you feel that you need some extra knowledge in these areas. There's a wide variety of career pathways open to physiotherapists. So as well as the actual health settings, of which I mentioned only a few, we can work in very non-traditional health settings as well, such as for corporate sector and as advisors to in the education department, to name a few different ones. But we have 3 main areas of practice, and that would be with neurological conditions, with cardiorespiratory conditions, and musculoskeletal conditions would be the key areas, but they can be spread across any age group. As I mentioned earlier, we've got a focus on preventive healthcare and chronic disease management, and that's an expanding area of physiotherapy and one that's probably going to be very important in the future of our profession. I've mentioned that we work across the lifespan. We work in multidisciplinary teams, and in some circumstances, a physiotherapist is the one who leads those teams. There are many different roles that we can play. We now have physios working in emergency departments, which is relatively new. When I say that, the last 10 years or so. And if you've got an entrepreneurial side, there's opportunities for you to develop in that way as well. We have some past graduates who have gone on to be entrepreneurs, one of them in health and fitness business, delivering meals for healthy meal plans and meals, has take that side to their business. So there's lots of different ways that you can use your physiotherapy degree in other parts of health. And this is just to show you the pathways for physiotherapy. So for you as school leaders, the most direct pathway would be through the Bachelor of Applied Science Physiotherapy. So as you can see from the diagram here, it's a 4-year course, and at the end of that 4 years, you become an accredited physiotherapist. That means you can be registered to practice. An alternate pathway is to enroll in the Bachelor of Applied Science, Exercise and Sport Science. And you can see that's a 3-year degree, and then you can apply to do the 2-year master's degree. And again, at the end of that process, you become an accredited physiotherapist. It's important to note that you still have to apply for physiotherapy at the end of that 3-year degree, and it's not an automatic acceptance. It's based on academic merit. And this is just to show you the other alternate pathway we have, which is to enroll in the Bachelor of Science Health with a human movement major. So that has some prerequisites. One of them is HSC Maths. And again, a similar process. It is a 3-year degree. You have to make sure you've enrolled in the right majors so that you have the prerequisite knowledge for physiotherapy. And then again, you apply for the master's program, and at the end of that, you become accredited. So I think that's all I have to say. So good luck, and perhaps, hopefully, we'll see you on campus at some stage in the future.
Thank you so much, Deborah. We will have time for questions at the end, so we'll get you back as well. But for now, I will introduce Associate Professor Kate Edwards, who is the Program Director of Exercise and Sport Science, and Associate Professor Jacqueline Raymond, who is the Program Director of Exercise Physiology.
Thank you, Grace. Hello, everybody. It's nice to be here this morning. I'm going to be talking to you about the Exercise and Sport Science program. So both Exercise and Sport Science and Exercise Physiology are within the same discipline. And the two courses are really very related. The difference being that the Exercise Sport Science is a 3-year program, which is a science degree. It's not a clinical career pathway as such. It's a degree which, if you're interested in exercise, you're interested in sport, and you're interested, you feel like science is a thing that you're good at, then it's a degree that students really tend to love and enjoy. The exercise physiology degree that my colleague Jacqueline Raymond is going to talk about is our clinical pathway degree to become an exercise physiologist and to work in the healthcare system in that role. So the exercise sports science degree is a 3-year program. If we can move on the slide, thank you very much. It's a 3-year program, and once you graduate an exercise sports science degree, you could go straight into the workforce where you would be qualified to specialize in designing and measuring and working out the best way to help people stay fit and healthy. It qualifies you to work with people who are currently healthy. And so we have graduates who work in all sorts of settings. We have lots of graduates who go into the sort of sports related areas, working with athletes to improve performance. Similarly, lots of people working in workplace health for corporate business, or in insurance, looking at the way that people can move and can complete activities. Similarly, we have lots of people working in healthy aging and the generic area. We also have people working in some clinical areas, helping other clinicians provide support for people delivering exercise. It's a degree which currently has qualifying accreditation, such that by the time you graduate, you should be able to register with the governing body, which is Exercise and Sports Science Australia, or ESSA. So it's a 3-year program. The indicative ATAR is 82. We don't have prerequisites, we do have assumed knowledge in chemistry and mathematics, but if you don't have those subjects, it's not a prohibition. In this program, you will do professional placement opportunities in your 3rd year. You'll do 2 different placement units across your 3rd year, which will total about 170 to 180 hours. And those will be in different sort of settings. They might be in gym settings, they might be in sports settings, they could be in all sorts of different places. What's really exciting about our course, so if we can just flip back, what's really exciting about our course, and this is the only exercise sports science course in the country that's like this, is that we've created the opportunity for you to do a 2nd major in anything you like. One of the things that happens when people come into exercise sports science is they don't really know necessarily where they want to go in the future. And that's great, because you can come in, you can do lots of different electives in different areas and work out where you're really interested. But you might also come into exercise sports science knowing what you want to do and knowing what you want to be. And in that case, you can choose to use all of your electives to give yourself a specialization, to make yourself stand out from the crowd. And that could be in a sport-related field, it could be in physiology, it could be in high-performance sport, but it could also be in something very unrelated. Maybe you want to do a 2nd major in media and think about your world of sports journalism. Maybe you want to do a 2nd major in Japanese because you want to go and look at the world and work with athletes or work with the community in Japan for whatever background reason that might be. You can take a 2nd major from anywhere across the university. And that means that you can make your degree exactly what you want it to be. So once you graduate, there's lots of things you can do. So lots of students come into our degree thinking that maybe they're going to do this degree and they're going to use it as a platform to go into another degree. And we have lots of students who are super successful in doing that. We are a fantastic degree for learning the science of exercise and movement. And so if you want to go on from that degree into another degree like physiotherapy or exercise physiology or medicine, for example, we have lots of students who do that every year, and they find that we give them a really good grounding and training in evidence-based practice, in measurement and interpretation, and in critical thinking and design. But you might also go straight into a career option. So you could work in sport, you could work in the health industry, you might work in the defence force, you might work in all sorts of different areas. There's really no limit in the sorts of areas that our students go into. Lots of our students stay and do other things. Maybe that's another degree, maybe that's research. We have research expertise in our discipline across the board, from metabolism to nutrition, to thermoregulation, to immunology, to clinical science, to all sorts of things. And there's all of those opportunities by starting your career with exercise and sports science. Okay, so I'm going to talk really quickly because we have a second exercise sports science degree, which is a double degree combined with the Bachelor of Advanced Studies. This degree has an extra year on it. It's exactly the same as the exercise sports science degree, but the extra year gives you the opportunity to take advanced coursework studies or to do your honours degree. And so it gives you that opportunity to do research within your undergraduate degree. So just like the exercise science degree, it's got the professional placements in third year, but that extra year on top gives you the opportunity to do those advanced studies or that research experience as well. Okay, I think that's where I'm going to stop, and I'm going to pass over to Jackie.
Thanks, Kate. Hello, everyone. I'm Jackie Raymond, and I'm the Program Director for the Bachelor of Applied Science Exercise Physiology program. And thank you for coming along today. If you've not heard of exercise physiology before, accredited exercise physiologists are part of a relatively young but rapidly growing allied health profession. So if you're someone that has an interest in health and exercise, and you want to make a difference to people's health and well-being through the use of exercise and physical activity, then this profession could be perfect for you. I might just hold back there, Grace, just one more, thank you. And so exercise physiology, as Kate pointed out, has a strong foundation in exercise science. And in fact, you can't become an accredited exercise physiologist without being an accredited exercise scientist. However, again, as Kate pointed out before, the key difference between the two is the focus on clinical populations, and that the accredited exercise physiologist, or AEP, will typically follow a career in the healthcare system. Okay, thanks, Grace. If we can move forward. Accredited exercise physiologists specialise in the use of exercise and physical activity to optimise health and function across the health spectrum and also across the lifespan. They focus on the prevention and management of many chronic and complex health conditions. A couple of examples are shown on the screen here. So obesity, diabetes and cardiovascular disease, poor mental health and cancer. In fact, poor mental health is one of the main growing areas for people, for exercise physiologists, as people become more aware of the impact of antipsychotic medications and sedentary lifestyle on risk factors and weight gain amongst those who have poor mental health. Exercise physiologists will also work with older adults to support healthy aging. They'll work with people with physical disabilities to improve and maintain function and independence. And they may also work with healthy individuals to improve and maintain health status and prevent decline. And our course is designed to prepare graduates for working across these roles, and it currently has qualifying accreditation with the professional body Exercise and Sports Science Australia at both the exercise science level and the exercise physiology level. Thanks, Grace. The Bachelor of Applied Science Exercise Physiology is a 4-year undergraduate program, and the indicative ATAR is 91. Similar to the exercise science degree, there are no prerequisites. However, there is an assumed knowledge of chemistry and mathematics. And there are several clinical placement experiences which are embedded across the degree. In year 3, students participate in two placement experiences, which amount to around 170 to 180 placement hours. And then in the final year of the program, students participate in 3 6-week full-time placement blocks across the year. And these are clinical placements embedded in a range of environments across the healthcare sector. So AEPs, or accredited exercise physiologists, work in a range of areas across the health sector. So for example, hospitals, private practice, and the community health settings. They also work in aged care and also in the disability sector. And they also can apply their skills in non-clinical settings as well. So again, if you have a passion for health and exercise and you want to make a difference to people's lives using exercise and physical activity, then exercise physiology might be the right program for you. Oh, and thanks, Grace. I'm also just going to talk a little bit about the clinical placement experiences that are embedded in our health professional practice programs. So all of the programs in the School of Health Sciences, including exercise and sports science, exercise physiology, and physiotherapy, include placement experiences as part of the program. And this gives you a great opportunity to get hands-on experience and put your knowledge and skills from your coursework into practice in a clinical environment. The placements that are allocated to students throughout their programs are across a wide variety of areas. So hospital settings, both public and private. You might be doing a placement in a private practice setting or in community healthcare centres or community facilities. And you can expect that you will participate in placements in the metropolitan Sydney area, but also in rural and remote areas. And Grace mentioned before about her experience up on the north coast of New South Wales earlier this year. Placements are a critical part of our programs, and they're required for professional registration or accreditation with the various professional bodies. And it's also important to remember that all students are required to complete New South Wales health requirements before their first clinical placement. So this includes things such as vaccinations and a national criminal record check. And there's a link on the slide there where you can find out more information about the pre-placement requirements. Thank you.
Thank you. So I think in my experience as a health student at the University of Sydney, the teamwork and collaboration that come through both your degree and your placements is one of the best parts that prepares you for real life practice. So my experience across the 3 years of my degree so far, I have completed 2 placements in a public hospital, 1 placement in community mental health and 1 placement in community paediatrics, so at a preschool and a primary school. But also in there, I've thrown in a couple of sessions at a community residential aged care facility. So the range of experience that you're getting is very broad. And in each setting, different other members of your team and other health professionals that you'll be working with. At the moment, the health scene is constantly changing, especially with the current pandemic. There is always changing and developments that require you to be on top of the evidence-based practice and work even more alongside other health professionals. This also includes with more long-term and chronic illness, including diabetes and cardiovascular disease. I recently completed a placement in cardiorespiratory, and I worked very closely with another physio student on their cardio-rest placement. So it really shows that these teamwork and collaboration goes beyond just your degree. But our new Susan Workhill building means that all nursing and allied health students are together. So those skills are also developed throughout the duration of your placement outside of those clinical placements as well. But now to kind of demonstrate the few different disciplines that we have here at the moment, we might go through a few different case studies to kind of get an idea of what the different roles health professionals play in the same kind of circumstance. So case study 1 is an elite sports example. So most of us probably will have watched the Olympic Games or the Paralympic Games, which are still on at the moment, without realizing that behind the scenes of our 400 competitor strong Australian team, that there was a support team of physiotherapists, psychologists, dietitians, exercise and sports scientists, massage therapists, exercise physiologists, nurses and doctors who were on call 24/7, spending their days based in the Olympic Village. These health professionals managed injuries, illness, the pressure, the highs and lows, So we're looking at both the physical and the mental aspects of sports here and touching bases with the coaches, families and support staff at home. So a quick scan of the National Rugby Team website show that the most elite rugby teams list at least 2 physiotherapists and 2 exercise and sports scientists associated with their team. So let's have a quick talk about the teamwork that occurs between physiotherapists, exercise and sports science, and exercise physiology in elite sport. So what would be the role of the sports scientist on the elite sport team?
Thanks, Grace. So exercise sports scientists do work a lot with elite sports. So in the relatively recent history, the Australian government has mandated that people working in elite sport are accredited with the national governing body. And so to become an accredited sports scientist, you first must be an accredited exercise scientist. So you get an exercise science accreditation, and then working in industry, you accumulate all the other requirements to become an accredited sports scientist. So lots of people with a background in exercise sports science end up working in elite sport. And that might be working directly with players, strength and conditioning, directly interacting with players. It might be managing and designing their training programs, specifying them for different players and in different environments, working closely with the physiotherapist, getting players back from industry and conditioning them, reconditioning them to readiness for playing. It could be managing the support staff team and managing the overall sport management process. So at every level within sports clubs, you get a lot of people with background in exercise science, and that could be from the strength and conditioning coach, the coach themselves, the team management. A lot of them will come with that background in the science of exercise.
Beautiful, thank you, Kate. So the sports group is one of the largest national groups within the Australian Physiotherapy Association. Deborah, what would we expect for the physiotherapist working with sporting teams or associations from local to elite clubs? You're on mute, Deborah. Sorry, thank you.
Thank you. Thanks, Grace. So just very briefly, you mentioned the sports group. So to be any registered physiotherapist who's a member of the Australian Physio Association can join the sports group. And then we have levels of further training, some of which can happen through university, some of which can happen as you accumulate experience and do short courses to become what we refer to within the organisation as a titled sports physiotherapist. So that's enables you to call yourself by a sports physiotherapist, and then you can go on if you wish to do further training to become a specialist through the clinical specialisation program through the Australian College of Physiotherapy. So I give you that background because most of the physiotherapists that would be working with elite sporting teams are probably what we refer to as titled sports physiotherapists. So you might get there by the practice you work in, servicing a sports team, and you go along and you start working there and then develop your interest and do further study. But now to talk about the actual role of a physio, and I'll start with talking about it at the elite level, either with a team or an elite sportsman. And often the main role of the physiotherapist at that level is coordination and communication. So they'll liaise with the athlete and the coach about appropriate exercises, rehab, return to sport plans, and that's also done in conjunction with team management and coaches, obviously with the athlete and even with the family at times. The physio is often usually working on field, and the NRL was mentioned earlier, and you'll often see at NRL games, the physio will be sitting on the bench, and they're one of the first people usually to go on field if there's an injury and there's extra support required. They're often involved in the decisions about whether an athlete needs to come off play or whether they can return to play. And if there's not a medical person, a doctor present, which certainly below the very top level, there often isn't, they'll be the one who make the decision that the person may need to go to hospital, call the ambulance. Otherwise, it would be done in consultation with the doctor. But often the physio is the gatekeeper of whether or not the player's allowed to continue at that time, and even when they might return to sport. So have a deep knowledge in the pathophysiology of injuries and are responsible for diagnosis of impairments and management. We do often work with exercise physiologists who probably know a lot more about technique, and sometimes the focus might be on particular technique and we would work together to address those needs to help someone recover from injury. However, you wouldn't walk in straight into a job with an elite team. So you usually start off at club level, which might be where you're the only person who has medical knowledge working with that team. And there you do all the different kinds of roles. You might be the strapper, you might do the massage, you triage injuries, you do the on-field diagnosis and management and return to play decisions. And so that's much more hands-on with management of what's going on during the games and after the games. And it's from there you would work your way up and maybe eventually get a job as with an elite team. But recognising those roles are few and far between, but really fulfilling for those that do them. So thank you.
Thanks, Deborah. And Jackie, finally, where do you see the exercise physiologist fitting into this picture?
Yeah, good question, Grace. So EPs tend to focus more on clinical work. However, it is possible that you might find them working with elite athletes. But in doing so, what they would be doing is drawing on their exercise science, knowledge and skills, and using that in the same way as an exercise scientist would work in the space, and as Kate described earlier.
Beautiful, thank you. So we will move on to our next case study. So I personally think that this case study is a very typical example that you will get as a student on placements, but I think it's also, if you end up working in a hospital setting or a clinical setting, a very typical setting that you may experience. So this case is a recovery from stroke case. So we're going to consider a 45-year-old male who is a smoker and who is overweight. We'll call him Darren. So Darren has had a left-sided brain hemorrhage, resulting in right-sided paralysis of the leg and arm, meaning that he now has difficulty walking, reaching, and lifting on his right side of the body. So Deborah, how would a physiotherapist typically approach the rehabilitation of this patient?
Okay, so for the physiotherapist, it's important that we would understand his background and his history. So we'd find out about his family, his work, his leisure, household tasks, and setup at home in order to figure out how best to help him with rehabilitation. We need to also understand the problem from their perspective. So it's very important that we make sure we understand what the patient's feeling and difficulties that they have in order to get them back to their normal function, so that we can frame goals around the focus of rehabilitation. So a physio working in a rehab setting, we would conduct assessments and observe and measure everyday motor tasks that Darren would be able to do. For instance, a timed 10-metre walk test. We would then test and measure the impairments contributing to the limitations of his everyday tasks. So there might be weakness, for instance. And based on our assessment, we would then develop an intervention program, likely with various kinds of exercises targeting the impairments. So it might involve strength training appropriate for very weak muscles, or practicing motor tasks, for example, working on a treadmill. Sometimes that might even be with body weight support, depending on the level of impairment the patient has. And then we look for ways that we can incorporate hundreds and thousands of repetitions into the daily practice for the patient, because high doses of practice is very important for brain plasticity and therefore recovery of function. Then when we're getting closer to discharge time, we would look at how the person can continue their rehab and promote lifelong healthy physical activity, whether they're supervised by a physiotherapist or whether they're referred to an exercise physiologist or for an independent program at home. Thanks, Grace.
Beautiful. So Jackie, picking up on what Deborah just mentioned, at what point would an exercise physiologist become involved in the rehabilitation of this patient? And what type of approach would you be taking with this patient?
Yeah, great question, and excellent introduction there by Deb with the role of the physiotherapist, and also explaining how they may link in with the exercise physiologist as well. So with Darren, I see two opportunities here where an exercise physiologist would become involved. And the first one, and picking up on what Deb said earlier, is later in the rehabilitation process, where the exercise physiologist would design a training program with identified goals and progressions, which is aimed to assist with regaining strength, building their functional capacity and maximising independence. And the second opportunity that I see would be to assist with the long-term healthy aging process through using exercise to manage risk factors such as overweight and obesity, and also to prevent a decline in health status as the person gets older.
Beautiful. And Kate, where would a exercise and sports scientist fit into this picture?
So the easy answer is they probably wouldn't. The more complicated answer is exercise scientists can be involved in delivering exercise interventions that have been designed by an appropriately qualified health exercise professional. So in the case that Jackie was talking about, where the exercise physiologist had designed a program, it's possible that you might have an exercise scientist in the clinic who wouldn't design that program, but would help implement it with the patient. But on the whole, I would say an exercise scientist doesn't really have a role in these settings.
Beautiful, thank you. So I hope for everyone listening, that kind of clarifies a little bit between the different types of settings that these three health professionals can work in, and also their different role in each type of setting. So we're just going to we have about 10 minutes for Q&A. Let me just see if I can get some of the live ones. But Erica, I can't see any of those.
Oh, that's okay. I'll just read them out to the panel. Okay, so the first question I've got here, if I wanted to get into a Masters of Physiotherapy at UC, which bachelor's course should I do? Exercise Physiology or Exercise Sports Science? Which is recommended of these two? Does it matter?
Who do you want to answer that first?
Yeah, Deb, you go first.
So as far as acceptance into the physiotherapy program is concerned, it really doesn't matter. As long as which by either of those degrees, you would meet the prerequisites in covering the background knowledge that we require. People are selected in terms of merit, and so it depends on how well you do in those degrees. Kate and Jackie very much explained the difference between those degrees beforehand, but part of what I always suggest to people is, because entry to the Masters is on merit, whatever degree you choose beforehand, I would suggest to choose it with the idea in mind that if you didn't get into physio, you'd be very happy in that career. So that, I think, should be the guiding thing probably about whether you choose exercise physiology or exercise and sports science. And both Jackie and Kate gave a really good overview of the career opportunities in those areas. So yeah, that's probably the best way I can answer that. It really doesn't matter from the physio perspective.
So I might just jump in and say that the exercise sports science is the 3-year degree and the exercise physiology is the 4-year degree. The 4th year in exercise physiology is very much clinical based. So it's designed to work you towards being a clinical exercise physiologist. So from that point of view, I think within the two programs, either is certainly possible, but if you really have a desire to get into physiotherapy, the 3-year option might be your choice. Now, the thing that I will say is the other option to get into physiotherapy is the Bachelor of Science Health program. And I would say really think carefully about what you go for, because the exercise science program is all about exercise and sport. And if you're not loving exercise and sport, you're probably not going to do great, and you're probably not going to get great grades in that course. If your interest is more the health side of things, now we talk a lot about health, but we're always talking about it in the context of exercise. If more of the health system and the health programs is what you're interested in, you might want to consider a different entry option.
Okay, thanks, Kate. And I've actually got two questions here, which are very similar, from people interested in physiotherapy and asking if that allows them to work within the sporting field or with elite athletes, or if it requires a further qualification after physiotherapy.
Do you mean if they've got the exercise sports science or exercise physiology background, or just if they
just physio? Just physio. So would physio lead to working with elite athletes?
Ultimately, yes, but probably unlikely as a registered physio with only entry-level qualifications. So to work with elite athletes, you probably have to do some further study in sports physiotherapy. And as I mentioned, that could be through some of the universities still have a master's program in postgraduate sports physiotherapy, or through the Australian Physio Association, they have a credentialing program to get extra experience and a qualification in sports physiotherapy. My understanding for instance, to go to the Olympics, you need that qualification as a sports physiotherapist. You might be able to work at some low levels if you worked in a practice where your practice, for instance, service one of the NRL teams. You might get some opportunities to work with some of the athletes with the team, but to get any responsibility, or certainly to get the role as employed by the club or something like that, you would need the sports physiotherapy qualification.
Okay, then. So what's the role of the sports scientist then? There's another question I've got here.
So the sports scientist is an additional qualification that you can get on top of the exercise science accreditation. So once you're an accredited exercise scientist, if you're working in the sports field, you accumulate those hours working evidence of your experience in the sports field, and you combine it with some additional professional development, and then you can become an accredited sports scientist. And there are different levels, so level 1, level 2, and becoming an accredited sports scientist is becoming a requirement to work in the elite sport environment. Okay,
thanks. Another question here for physio. Can physios work in hospitals, and if so, how? I think we covered that, but Deb, to answer that one.
Definitely, and in fact, probably at least, if not more than half of registered physios work in hospitals. You can basically apply for the job, and if you're selected, you can work there. You don't need any special qualification beyond your entry-level degree to work in a hospital environment. And it can be public or private hospital, or even private practice. There is what we call an allocation program immediately on graduation, which is competitive to get into and on merit, and with applicants from across all the other degrees in the state, where you have 1 year in one of the big teaching hospitals. And that's as a first-year physiotherapist, but some of the hospitals now aren't taking part in that program and are just advertising their positions separately, which obviously people can apply for.
Okay, thank you. Here's a different question. What sort of industry partnerships and placements within exercise sports science does USyd have in the sports industry for those interested in working in high performance sport? The earliest...
Oh, God.
Sorry,
So,
go on, Kate.
Look, lots is the answer. So your professional placements in third year, you're very likely to have a professional placement in a sport-related field. So we have really strong links, especially with Sydney Uni Sport and Fitness, which has lots of elite athlete programs, but also with other groups as well. But the other thing that we have is, because we're very well respected and we have such great students, lots of the professional clubs come to us to ask us to advertise internships. And so these are not part of your degree. These are something you would do additional to your degree, but you would get the opportunity to apply for internships. And we advertise lots of these every year with a range of clubs, from Sydney Kings, the Sydney Swans, GWS Giants, lots of the rugby league clubs, the Swifts, all sorts of clubs across, and Cricket New South Wales, all sorts of them come to us to ask us to advertise internships to our students. So as well as getting the education and the experience that we provide for you, we also have that network to allow you to broaden your work and increase your CV.
Fantastic, thank you. Now here's a question for physiotherapy. How many units of clinical placement do you offer over the physiotherapy degree, and at what stages of the degree does this occur? And what are some of the fields that you provide placement opportunities in?
Yeah, so we start with what we call mentored clinical placement in first year, which is just placement, which is mainly observation, usually in a public hospital or could be a private setting, where you're really just getting a feel for what a physiotherapist can do. So the first real placement is at the end of year 2, which starts off with a week in our simulation laboratories, where it's basically set up like a clinic, and you're working with actors who are simulating being patients. And then immediately following that is a 2-week placement, again, usually in a hospital and usually involving inpatients in a hospital, to just start to get an idea of what it's like working as a physiotherapist in a hospital setting. Following that, there are, at the end of 3rd year, there are 2 5-week placements. And then there are, in 4th year, there are following also 2 5-week placements. Amongst those 5 placements, you tend to do one in what we call a rehab setting. So in those ones, you're likely to cover people at any kind of rehab, often involving people who might have suffered a stroke or some sort of neurological condition, but it could be rehab for chronic pulmonary disease or cardiac disease. You have one that is called acute care, and that's when you're seeing people, usually acute inpatients in hospital. So that could be they're acutely ill, they might have had surgery, those kind of things. We have one ambulatory care, which is like outpatient clinic. So that's probably where you do a lot of your musculoskeletal type of work. And then we have one that sometimes can be an elective, and it can be in any of those settings, or it could be in private practice, it could be pediatrics, it could be with some geriatrics. So that can be a wide range of things. And then there's another one, which is a 5-week, which is a unit that's done in 4th year, but it's a little bit more academic. You're linked with a health provider, and in a group you develop a program, a quality improvement type program for healthcare. So that one's not strictly a placement in a clinical setting, but it's liaising with a health partner to have a look at some aspect of the care that they offer.
Great, lots of great clinical work there. And Kate, this will just be the last question now, because we're going to have to wrap up, unfortunately. So we do have a few questions which we'll get to back in writing via email. But Kate, what second elective would be recommended in the ESS degree if someone was interested in applying for the Master of Physiotherapy afterwards?
So all of the prerequisites for the Masters of Physiotherapy are covered within the core degree, with the exception of neuroscience. So we recommend that you take a neuroscience elective if you're looking to get into the Masters of Physiotherapy. Beyond that, we recommend that you take the electives that you think are most interesting, because the most interesting subjects are the ones you're going to do best at, and the best grades you get are going to help you get into the Masters of Physiotherapy.
Yeah, that's right. Really, if you focus on the areas of your interest, that's what we find always helps with students achieve their best. Now, I just want to thank our panel very much for delivering today's presentation, and also Grace for her sharing her student experience with us. Now, there are lots of questions here which unfortunately we didn't have time to answer, but we'll be getting back to you in writing shortly after today's open day. Please enjoy the rest of the day. Thank you.